طيب شايفين البرزنتيشن؟
واضح يا دكتور.
طيب بسم الله الرحمن الرحيم. So this is an introduction to systems review, talking about sensitive topics. Okay, it's very important for you to be able to communicate very well with the patient. خلاص. So system review is a part of history taking. يعني دحين احنا هذا كله كلام. It's in the history taking. So when we reach the stage or the phase of systems review, we have to ask the patients specific questions, sometimes sensitive topics. Okay, so we need to be familiar, and the way to do it is practice, practice, practice. It's very, very hard in the beginning, but when you advance, then you can really become familiar with sensitive topics and how to ask about them in a way that protects the patient dignity and protects your safety. So these are very, very sensitive topics. Sometimes you can get into troubles. Sometimes the patient can get into trouble. So please, the get home message from today is try to practice, practice, practice the way you talk and the way you approach patients and the way you communicate with patients. This is very essential. Okay. What are the intended learning objectives? To describe and place and the function of the systems review in consultation using the Calgary Cambridge approach, to become familiar with effective specific questions, and to be able to conduct, inshallah, review of systems that is going to be very essential for you in the next coming years. So from now on, all your life is about history, examination, investigation, and management. From now on, inshallah, إلى لما يعني بإذن الله تتقاعدوا أو بعد التقاعد. So it's very important to know this. Okay. Also, to recognize the factors that affect the reliability and validity of patient self-report of sensitive topics. So, and also to understand and practice communication, to be familiar with some basic screening procedures. Okay, so this is, as you know, and you might have taken this before, the Cambridge Calgary framework. So to initiate the session, you are trying to gather information, and as you go further, you are providing structure and building relationships. So be very important, be very familiar with this. So you are asking questions by and gathering information, but in fact you are building a relationship and you are providing a structure or a framework that you are building your management upon. So what is we all we waste few years of life, especially this year, next year, and fifth year, in this gathering information and physical examination. Very, very important. Okay. So gathering information, it means you have to take it from the patient, so patient's perspective and biomedical perspective and background information context. We are focusing today on the biomedical perspective. Okay, the biomedical perspective, which is very important, as you know, divides into the chief complaint, which means Allah يخليكم احفظوها, because now even 6 years they don't know how to do it. Chief complaint, it means the main patient complaint plus time. So abdominal pain for 3 days, headache for 24 hours, limb pain for 1 week. Very, very important to put the patient complaint and the duration. This is the chief complaint. Then followed past medical, past surgical history, family history, social history and personal history, and systemic review. So today we are focusing on these two, social history and systemic review. Okay, why do we need to review all the systems? We need to review all systems sometimes in a very fast way, okay? Because sometimes symptoms or concerns patients may not mention. Patient may not think they are relevant. For example, انتوا مريض يجيكم في العيادة يقول لكم أنا عندي headache. يقوموا خلاص you focus on the headache, you ask everything about the headache, لكن تيجوا you are neglecting مثلا or I am neglecting the dizziness or vertigo. اوكي and the patient يعني يقول لك انا ما همني الدوخة، لكن sometimes it's relevant headache with دوخة غير الهيديك alone. So that's why we do review of all systems. مثلا another example dizziness دوخة. الدوخة ايش لها علاقة بالقلب؟ لها علاقة وطيدة صح؟ If I forget to ask a patient, old guy or old lady about cardiovascular system while their main complaint is dizziness, then it's a failure because most common causes of dizziness and headache and stroke issues are due to cardiac issues. So I have to ask about the heart. So very, very important. Okay. Other cause, other reason to consider other systems not covered and to identify red flags. So very, very important. So that's why weight loss and cachexia and other stuff are very, very essential. Okay. System review helps you not to miss anything. Any significant finding should be moved to the history of the present illness or past medical history depending upon where you think it belongs. وهذا الشيء اللي بقول لكم هو يعني لما نيجي ناخد الهيستوري وبعدين نقدم الأشياء الريليفنت زي مثلا dizziness and you ask about the cardiovascular system وطلع عند المريض angina عنده chest pain عنده مثلا wrist pain عنده مثلا orthopnea. هذا لازم تحطوها تنقلوها لفوق تقولوا the patient is also having cardiac symptoms which might be related صح؟ ممكن يكون سبب dizziness it's only from his heart disease is not central. Okay. When to do the system review? A system review هذا is a very important question. Okay. It is done at the end of the history of the present illness and at the end of the information gathering. Okay. The symptoms covered in the analysis of the HPI will not be repeated. خلاص don't repeat السيمتومز. يعني مثلا واحد سألته قلت له عندك دوخة و chest pain تقوم تيجي في الكارديوفاسكولار سيستم تعيد ال chest pain because you are already analyzed you have already analyzed the chest pain. Okay. How can you conduct system review? It's many techniques, but the curriculum encourages you to use appropriate signposting as you begin. For example, I would like to ask some general questions to see if there is anything else we need to look into to make sure we have covered everything. At the end, always ask the patient if there is anything else. Very, very important. So anything else I can help you with? It's very important. Sometimes I know the clinic time is short and we cannot ask all the questions, but try as much as you can because this will save you time later. Okay, how? Ask how to ask, as I told you, it is at the end of the history presenting illness or at the end of information gathering. It should be relevant, focused and complete. For example, تمام إذا البيشنت عنده مثلا angina or chest pain. Okay. I cannot ask him in details about abdominal pain. It's not relevant. Okay, even if the patient tells me in the review of system that he's having abdominal pain, I can, for example, ask about the causes briefly, but most of the time it's not relevant to the chest pain. Okay, what are the components of the system review? General components, general symptoms, GI, respiratory, cardiovascular, urogenital, neurologic, musculoskeletal system, endocrine and vascular review, and finally gynecological review if it's a female, or sexual review if it's a male. So it's very, very important. The general symptoms. Example, most common symptoms that you need to ask for is fatigue, malaise, and weakness, and usually it is obvious. Anorexia, change in appetite, fever, rigors, night sweats, change of weight, skin rashes, bruising, and sleep disturbance. Gastrointestinal symptoms or system, you need to be very familiar. The appetite, diet, weight, teeth, swallowing, regurgitation, flatulence, and other symptoms that are not mentioned here. For example, obstipation, constipation, bowel habits, and other. And most important, the jaundice. It is not mentioned here, but you have to ask about jaundice. It's very, very important. Changes in stool color, changes in stool habits, changes in bowel motion, changes in, for example, the appetite. It's very, very important. It is mentioned here. Dysphagia, nausea, jaundice, abdominal pain, bowels. Very, very important. Okay. What about the respiratory system? Respiratory system, many symptoms, but mainly shortness of breath, cough, hemoptysis, dyspnea, wheeze, chest pain. Cardiovascular system, and the cardiovascular system, usually it's a mix of cardiovascular and respiratory, so you can have lots of symptoms in common. For example, chest pain, dyspnea, orthopnea, palpitations, cough and sputum, dizziness and headache, ankle swelling, and peripheral vascular symptoms such as wrist pain, swelling, edema, and changes in the skin. Okay, urogenital system. Urogenital system is very essential, so you need to ask about loin or groin pain, micturition such as dysuria, urgency, hesitancy, hematuria, change in color or smell of the urine. What about the gynecological system in the female? Especially, you need to ask about the menses, what is the duration, regular or irregular, the heaviness of the period, and other stuff. Pregnancy, vaginal discharge, postmenopausal bleeding, contraception, dyspareunia, and obstetric history. And dyspareunia is very delicate symptoms that many of our colleagues feel shy to ask about. But if you have time and if you are really into gynecology, then you will be more familiar with these and what they mean, because sometimes they are very important. They can save females and you can save a lot of males. Neurologic system is very important to ask about, and mainly you are talking about simple neurological symptoms such as the loss of consciousness, loss of vision, which speech, the senses, hearing, loss of power, loss of balance, paresthesia, headache, tremors, and behavior or mood changes. So generally you are asking about the sensory system, motor system, plus minus the higher cognitive functions, such as the memory and intelligence, as well as the insight and etc. Musculoskeletal system is really joints and muscles. So pain, swelling, limitations, and weakness and disturbance of gait, which can be really related to the musculoskeletal system and not the neurosystem. Vascular review is very important. Vascular review is one of the broad systems. That means it can give you a broad number of symptoms such as neurosymptoms, abdominal back pain, swelling in the abdomen because of the abdominal aortic aneurysm or mesenteric ischemia. Claudication, very important to know the difference between neurogenic and vascular claudication. Okay, and this is a very important topic. Limb pain, color change, pigmentation, and limb temperature. Other symptoms such as endocrine system, you can ask about menstrual abnormalities, hirsutism, alopecia, abnormal secondary sexual features, polyuria, polydipsia for diabetes, and other hormonal disturbances, amount of sweating, and quality of hair. Uh, Now, after systemic review, we need to ask about personal and social history. They usually come at the end of the history taking or at the end of the biomedical history. But it's very important sometimes, and sometimes you feel you need to ask about them. For example, يعني بلاش نيجي مثلا للأشياء اللي هي فيها حياة أو هذا ممكن تيجي للأشياء اللي هي مثلا زي واحد مسكين يجي له recurrent chest infections، فأنت لازم تسأله أنت فين شغال. ممكن يكون شغال في المناجم، ممكن يكون شغال في البناء أو العمار، ممكن يكون شغال في مكان يعني high risk of respiratory pollens exposure. فأنت لازم تسأله what is the lifestyle, what is the environment, what about the personal habits, what else. It means everything that you might think will change your diagnosis. For example, if somebody coming because of, for example, frequent sexual transmitted disease, so I have to ask about his lifestyle. Is he like traveling a lot, making contacts with different peoples, no protection, stuff like that? It is needed, especially if somebody comes frequently with these kinds of infections. Okay. Is it always easy to ask about personal habits? The answer is no. It's very important and be very careful to establish a good relationship between you and the patient before asking about these questions, because sometimes it can be taken as a negative, and some patients get very upset when you ask about this. Okay. So what are the sensitive topics? The most common is alcohol intake. Why? Because many people drink and they don't want anyone to know. Smoking is the easiest now because it's generally acceptable. Illicit drugs abuse is very sensitive topic. Sexual relations, intimate partner violence, and this is very important to know about. Others sensitive topics may be the main presenting symptom problem of a patient with mental illness, suicidal ideas, physical or sexual abuse, etc. Okay, what are the factors affecting patient self-report of sensitive topic? هذه تقسموها قسمين. Either I think it's a patient related or it's a problem related. تمام. مثلا patient related, so patients is very yeah, or I mean yes, problem related. So problem is so bad that I cannot ask the patient. For example, you're on an anxiety to talk about certain topics. What's the cause? Be aware of what is going on in your head and with your own feelings. يعني مثلا يعني مثلا هذه كمان أكثر لإخواننا، يعني مثلا اللي هم مثلا يشتغلوا يورولوجي أو يشتغلوا gynecology. تمام. A female coming with frequent purulent or foul smelly vaginal discharge, and she comes frequently with this complaint. So we need to ask her, what do you think the reason? Or do you have one partner or multiple partners? Do you have, is your partner, for example, infected, or do you think he is infected? And you really need to get deep into these topics, because without clear history, you cannot know the diagnosis. So many reasons for that. And there will, even in the best hands, there is a failure rate which is high. So be aware of what's going on in your head and with your own feelings. Your own anxiety may prevent getting a thorough history. So, and the only way, as far as I know, as my humble experience, is to try to talk about this more and more and try to do more histories. Okay. Second, patient anxiety. So always think about these factors as factors coming from you or factors are coming from the patient. patient anxiety, why the patient gets anxious؟ ليش؟ لأنه محرج، embarrassment، being judged، اتوقع انك انت تحكم عليه على طول، مثلا اذا جاي بديل infection so it's a bad guy، إذا مثلا doing something very wrong، يعني عشان كده المرضى ما يتكلموا. So try as much as you can not to judge, even when you ask questions, even the way you ask questions, try not to ask too much. Okay. I mean, try to ask, but not to really get into trouble. Okay. Topics are one rarely discusses: confidentiality, relevance to care. Okay. techniques to improve reliability. يعني دحين أكثر شيء أكثر شيء آه
دكتور قطع الصوت.
الآن قطع ولا لا؟
لا الآن شغال كويس.
Techniques to, okay. So now techniques to improve reliability of reporting sensitive topics means okay, sorry. So 1 second, please. 1 second. Hello, السلام عليكم. Sorry, back again. Uh, okay. So as you know, these يعني topics are very sensitive. تمام. فتوقع انه كثير بيكذبوا، يعني مو بيكذبوا so they are not reliable. يعني ممكن يقولوا كلام، اي كلام، ممكن يقولوا كلام which is not true، ممكن يقولوا كلام which has secondary gain، يعني يبغوا يكسبوا من وراء مكسب. خلاص. So it's very important. Are you listening معايا في الموضوع ده؟
معك دكتور.
ايوه
تمام.
معك.
ممتاز. So it's very essential to know how to ask and how to discover reliability. يعني متى تقول انه البيشنت هادي ولا هذا والله بيكذب، ولا انه is not telling everything، ولا انه is not helping. تمام. ومتى تقول انه البيشنت هذا he is good. خلاص. So the way to do it is to prepare the patient and how you ask the question. It's very important. And usually usually يعني إذا كان المريض والطبيب من نفس الكلشر وبنفس اللغة بيتكلم، ويوجوالي التفاهم يكون أسهل and asking questions becomes easier. But أصعب شيء when you ask patients when there is a linguistic barrier. You can never have a complete reliable history. Okay. How to prepare the stage? Normalizing. يعني مثلا نقول له مثلا احنا عادي في يعني مثلا عادي في المجتمعات مثلا الغربية انه الواحد يشرب، مو زي هنا، يعني عادي هناك ما حد يحكم على احد. انت تحاول تخليها normalization، وبعدين you ask the patient تقول له عادي في المجتمعات الغربية مثلا يشربوا عندهم عادي، يعني انت ايش رايك؟ هل يعجبك الكلام ده والشرب زي كده؟ you try to normalize. Transparency is being really honest when talking, asking permission and addressing confidentiality. Okay, so normalizing, using universal statements to normalize the problem. For example, many people find it difficult to talk about their sexual concerns, activities, practice. What do you think about that? Many people with chronic illness notice they have problems with sexual function. Have you ever مثلا noticed that you are sexually weak or stuff like that? تمام. Transparency ما معناتها انه وقاحة، معناتها انه to establish to being honest، تقول للمريض انه this is really important to me to have diagnosis. اوكي، وتخليه يفهم المريض، اما مو وقاحة، صح؟ To establish his relevance to care and explain why you are asking, explain the need in a medical setting to discuss taboo topics. Okay, very important. Transparency, it means being honest. يعني يفهم المريض انه I'm asking about this because I want to help and it's relevant, not because I am like getting into or interfering with your business. Okay, I need to ask you some very specific questions about your vaginal discharge in order to better understand your current problem. And then asking permission, very important. May I? Yes, you may. Would you allow me if I tell you this? Stuff like that. So it's very important. Tell patients they have the option of not answering is very important if it makes them feel uncomfortable, and it makes them most of the time feel better. Okay. ودي زي انتوا كتير تستخدموها، يعني عادي لو سألتك عن الشرب، عادي لو سألتك معلش على السؤال انت تدخن زي كده، لكن هذه اشوفها اشياء not relevant. Why? Because most of the time it is not related للهذا. Though smoking and alcohol يعني استغفر الله في كتير يعني يعني واغلبنا في مننا مبتلين يعني بالنسبة للاشياء دي. Smoking and alcohol is very important to ask about. Okay, why? Because it can cause systemic disease. مثلا smoking is related to many cancers and is related to heart and lung disease. Alcohol is even worse. It is related to many diseases, including brain, liver, heart dysfunction. So it's very important sometimes to ask about these questions. Okay, addressing the confidentiality concerns. So you tell the patient that it is gonna gonna be confidential, but you cannot promise the patient that you are not. يعني مثلا ما تيجي تقول للمريض والله ما علم أحد، والله ما إني قايل لأحد، هذه بيني وبينك. No, because you need to write it in the file. If the patient is alcoholic, even if he's your father, you need to write it in the file. Okay, and here becomes a very ethical issue and dilemma. So you cannot promise 100% because sometimes مثلا for example if you discover a patient is having مثلا لا سمح الله HIV or a problem, you have to tell the family. At least you have to protect people from the patient. Okay, or sometimes you need to protect the patient himself. For example, if you are having a patient with suicidal ideas, you cannot ignore these symptoms. You cannot ignore these symptoms. So you must not promise the patient 100% confidentiality. Okay, and patients have a right to be informed about this. Okay. Example, chart documentation reporting certain conditions, harm to self or others. So these are very, very sensitive topics. So you need to ask the patient while reassuring him that you're gonna treat him well and you're gonna do most of what you can to protect the patient dignity and health and autonomy, but you cannot promise the patient that this is 100% confidential. And the way to do it is practice 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 عشان لا يحصل مشكلة مع المريض and you are in a very bad shape. How you ask questions, form of question using closed-ended questions, offering response choices, careful word choice, assuming the behavior is occurring, and order of questions. Closed-ended questions يعني مثلا تسأله خلاص الإجابة بيس أو نعم. Okay. Open-ended questions tend to increase anxiety. مثلا نقول are you currently sexually active, how many partners now, in the past year in life. هذه closed-ended questions مرة yes or no وجوابها سريع. How many drinks of alcohol do you have in an average week? It's closed-ended question, not open question. يعني مثلا ما نقدر نقول له كم كاسة كحول تشرب. ما نقدر نقول، نحدد له نقول له كم كاسة تشرب في الأسبوع. Okay. Other response choices, offer response choices. How much of the time would you say you use condoms? Never, sometimes, always, almost always. And give them examples of answers. يعني خيارات للحل. طيب. Careful word choice. يعني مثلا avoid illicit drugs, street recreational drugs. Okay. But better تسألهم have you ever used marijuana, have you ever used cocaine, have you ever used مثلا morphine, stuff like that. Okay, asking for facts rather than judgment. Do you think often? Do you eat a healthy diet؟ يعني مثلا بالعربي نقول له انت بتفكر do you drink دائما تشرب، دائما تدخن، دائما مدري، دائما. الأفضل منها إنه نسألهم how often do you drink or how often do you smoke أو do you get drunk أو مثلا how many drinks do you typically have. في the other questions زي كده برضو. So why? Because only the patient knows the meaning of often, drunk, healthy and good. So you get no specific answer if you ask the bad question. Assume a behavior is occurring. For example, do you think about suicide? You assume that it's not happening. Better, how often do you think about suicide? Okay. Another, be careful because they are leading questions. Okay. Alcohol screening. This is very important. Step 1, step 2, ستيب 3 and 4. ستيب 1 you ask the patient. هذا تحفظوه زي ما هو لأنه هذا معروف عالميا الكحول سكرينينج. فستيب 1 تقول له have you ever used alcohol? If no, stop. Okay. When was your if yes قال لك when was your last drink okay of alcohol. تمام. إذا قال لك أكتر من سنة خلاص stop. اوكي. اذا قال لك لا اقل من سنة يعني استخدمه قريب اذا you ask about the quantity. On average how many days per week do you drink? If excessive go on to step 3, otherwise stop. Step 3 dependency. So first, have you ever used alcohol? Second, quantity. Third, dependency. Have you ever used more alcohol than you meant to? Have you ever felt you need to cut down? Okay. These are very important questions. Same thing for illicit drug screening, 2 or 3 steps. The first step, have you ever used? Ask about each specific drug. Have you ever used marijuana? Have you ever used cocaine? Have you ever used other stuff? Usage in the last year. If no, خلاص stop. If frequent or recent use, then quantify. The greatest amount used on one occasion in the last month, typical amount used per occasion, and then dependency. It is, have you ever tried or failed to control, cut down, or stop using the drug? Okay, now we go to so we finished the systemic review, we finished the personal and social history. Now, sexual practices and concerns. General communication tips. Delay until you have established rapport. Use preparation techniques. Use screening questions. Use closed-ended questions. Response choice good for sexual activities and practices. Use correct anatomical terms and formal names for activities and condition. For example, you have this screening. When was your last sexual encounter? If the person has never had a sexual, stop and ask about sexual concerns. Do you have any sexual concerns or worries you would like to discuss? Are you having any problems in your sexual relationships? Number of sexual partners past month, year, live, okay? And current and past use of condoms, use and concerns about birth controls, and history of sexually transmitted disease in the patient, partner, and or concerns about STDs. So, take a history of presenting illness. If the sexual problem is the presenting illness, so it is treated as any chief complaint. So, prepare the patient, ask specific details, normalize the problems, ask the permission, provide transparency, and exactly what has been going on and how can I help you. Very important. So, practice, practice, practice makes perfect. Thank you. Any question? I hope it's clear.